Thank you, Dr. Gerdelution, and just wanted to say, on behalf of the symposium, I think it's been a fantastic set of meetings, especially the session that we just finished. Got a great group of experts up in front of us, and really looking forward to the questions and discussion that we have from here. There's a lot of different ways I think you can tie together the different talks that we've had this afternoon. And then, of course, we can always count on Dr. Miles doing a physical exam on any elephant that might be in the room. So with that, we'll start taking questions. Okay.
Questions for Craig. As we go to our producers and things, what is your benchmarks for your A clients?
Previous history is big, but the basis goes back to where the cattle. I want to know how the cattle are handled. I want to know how the calf's handled in vitro, really. I really want to know the whole history of that animal. Did you have any issues? Was the nutrition program adequate? On the cow? Did the calf get vaccinated prior to being turned out? Then we're going to follow the health, but really the performance. It goes back to performance, health, and death loss. Those are our three main components. Because we've got cattle in there that have increased. We need calves, and it's a long-term relationship. I guess that's what I'm trying to say. It's pretty hard to get on the A list, but it's long-term and it's fixing the problem. If we say we recommend that we tie our veterinarians with your veterinarians and we need to fix this problem and we see progress, that'll keep you on the A list.
I just have an observation, and I guess I would field the opinions of those who attend a lot of these meetings. Has everybody noticed that Dr. Miles is a lot more mellow since they legalized marijuana in Colorado?
Just a question that I would have on the commingling topic, Dr. Stepp. That it's a great applied science, as Dr. Miles pointed out, when it fits your bias. So obviously, not commingling the ranch and the market calves. In my world, I question, should we be commingling Dalhart sale barn calves with Southeast board sale calves? Is there any opportunity to not commingle those populations?
I guess we're going to go back to the smile and opinions and everything. I don't know of any particular information out there where they've commingled them. I do know that when we keep receiving cattle in, and Dr. Comfer and Dr. Fulton and I, we do see tremendous differences in truckload lots. And some of those loads are from different buyers or different regions or locales. And because of that, if you can keep them separate, I would think, an opinion, speculation, that then you can manage them accordingly instead of commingling them. But that's just kind of some of our observations. But I don't have any numbers or data behind that. So, but I'd be open to anybody else's opinion.
This is for Craig. Craig, could you elaborate a little bit more on what we talked about yesterday on the springtime or branding time vaccinations that you look for in calves? There was a discussion a little bit ago about summer pneumonias. And so I'm sure you're not talking about just a blackleg vaccination, but what else are you looking for in that springtime work with the calf?
Well, we think we're building that calf's immunity. I mean, there's we want to go as close to turnout as we can, and the data, as we follow back on these cattle, it's just observational. But as we go back and test some of these calves, if the calves don't have the spring shots, when we go through the packing facility and do lung lesions, we'll see a way higher incidence. And those calves typically, a lot of times we find out if we have a trouble with the set of calves that did not have the spring shots. But we think it's more important in there because the summer pneumonia masks itself so well because the calf gets sick, and if you're not out there seeing them every day, most of them calves will get healthy again on the cow. And then later on, the challenge will come to them, and if they don't have their full lung capacity, that's when we see the drawdown, because we're going to put them in a challenge anytime we come into the feed yard. That answers the question?
Yeah, Dr. Stepp, curious on the first study that you talked about, the single vac versus revac, where you didn't see a lot of differences between the two. You had a comment that you did see differences in the feed to gain ratio on an improvement with the revac. And I was just curious about study design. How many different pens did you feed, or did you have Kalin Gates, or how did you get to the power to make that decision?
On that, we didn't see any difference, and we were just using the pens on in the receiving period or the preconditioning period. There were the growth safe system at the finishing phase. I'm going to have to defer to the biostatistician on that when they came up with that information on the power. So.
Yeah. The growth safe system doesn't give you an individual animal feed intake, or is that system set up to where you did have individual animal feed intake?
My recollection was it did have individual intakes.
Must have. Good. Thank you.
Am I there? Question for Terry. Do the calf producers in California work closely with feedlots? Do they get feedback back from the feedlot that tells them or suggests what they might do?
So I can really only answer in the context of the one large calf ranch that's our client. We don't work close enough with the others for me to be able to say. So for the one that we do work with, they're about a 70,000 head calf ranch, and they work really closely with their customers, and they know what they want and how they like their calves, and they get reports back. And I know, as just one example, they sort the cattle really carefully so that they're very tightly grouped in terms of weight when they leave the calf ranch to go to the feedlot. So yeah, they do work with them pretty close, and at least that ranch, in my opinion, has really high level of management, and they're really quality focused, and so that's just an important part of the way they run their business.
Dale, this question's for you and Dr. Mike Apley. With your crystal ball, as we look forward into this 5 or 10 years from now, and I think your philosophy is right about what is the politician going to try to do to us. But as we take away or lose the antibiotics and go forward, what's going to happen to the consumer and the perception of the cattle industry as we go forward in that short period of time if we don't come up with more aggressive ideas than what we've come today and over the last 40 years for my practice?
First of all, I don't think we'll lose them for therapeutic use. That's one. Two, I think they're going to find, as Denmark has, when we modify what we've been doing, especially on feed additives and maybe metaphylaxis, they're going to find that the resistance pattern in the human population will not change. And Dee pointed that out very succinctly, puts us in a win-win position. So I think we'll be able to use that information. I think as an industry, and this is in that area of I may be wrong, but I'm never in doubt, but as an industry, we are overreacting, and as a profession maybe, we are overreacting to a small vocal minority. And there are some issues that we should take the fight on, but there's a lot of them that we should just duck our head and go on about our business. And I was taught that by a poultry fellow by the name of Shelby Massey. He said, do you remember the response of the poultry industry to the fecal soup deal that hit 60 Minutes or 2020? And I said, I do not. He said, the reason you don't is because there wasn't one. We just went about our business. And he said, you guys in the cattle business get one fleck of manure, that's not what he said, but one fleck of manure on your white hat, and you have to keep it in front of the press for them. And he said, our deal went away. So this is one of those issues, I think, we take the best position we can, and in time, I think the consumer is going to see the folly of what we've been through. Mike, comments?
Takes a minute to go. I think you pretty much hit it. The issue for us, I agree, is not going to be therapeutic use. It's going to be what is perceived as routine systematic use for a disease that is created by the nature of the production system. That is what the focus is going to be. And I agree that there's some groups that make a lot more noise than they really have strength behind them, but I'm afraid that some of the supply chains aren't making that distinction. And the thing we can do as an industry is to continue to improve in our demonstration of making really sound decisions about how we use antibiotics. And, Dell, I saw, just as a follow-up, Dell, I saw you use Louis Pasteur as your starting slide. He's kind of a hero of mine, too. And, yeah, damn it, you took this thing right out of that. I was going to ask if you had any anecdotes when you were in school. I hate you. Thank you.
So Craig mentioned the relationship between the veterinarian and the client, and then Tom brought out the fact that cow-calf veterinarians must be the poorest marketers in the entire world. We've got tons of new graduate veterinarians that would love to do more for the client. I mean, we talk all the time to our students about, not trying to drive more miles or drive faster or have more clients, do more for that client. What can I take back to my students and tell them from you two smart guys?
When we evaluate the veterinary service that we're going to take on, the first thing that we look for is when they bring a solution to the table, do they bring it in the form of alternatives with the costs associated with them? And if that happens, that person's going to get a lot of our business because they're giving us the opportunity to think with them about, here's the trade-offs. They've recognized up front there are trade-offs, right? They also are, I think it's important to hold the client accountable for certain things, right? When we promise we're going to do X, we better do X. And for us, it's an integrated solution. We're looking for an integrated solution. What I would love to have is a one-stop shop on nutrition, health, and genetics. And we had, so I got one really great assistant coach instead of having to be on the phone with 3 or 4 of them, who helps me with those 3 things. And quite frankly, we'd seed a lot of the decision making as long as we had control over thinking through the budget side of it. We'd seed that out. So solution-focused alternatives, and conversely, there are clients you don't want. I learned that early on. We had a great vet in our community when I was a kid named Doc Starkeybaum, and we had a neighbor who was proverbial, never going to call the vet till it was too late. Finally, one night he was down her cow. Doc circles that cow about 5 times in that barn. It's about 2 in the morning. Producer says, Doc, do something. So Doc Starkeybaum fell to his knees and started praying over the cow. And that's when I figured out we had accountability as well.
Well, 30-some years ago when I was interning, I went and I got to put a plug in for my vet clinic and how that's transformed over the years. And it's become a reactive versus proactive. And as Tom showed you, we got a lot of young new producers coming in, and they really don't. They're going to ask the question, and they're going to want to be more involved, and they're going to be more receptive. But the first time I talked to the old vet that's retired, he says, I said, Doc, I think I got a water belly. He says, I'm the vet. I'll tell you what you got. I said, what is it? He says, it's a water belly. And today it's just evolved over the 30 years, and part of that's the style, and it's our partnering with our vet clinic. And today we put systems in place, and these are the protocols. We have a SOP book this thick, and they design the systems, and they facilitate. We do the work. We have that. We develop that relationship. And what they do is they take all their cow-calf clientele and they put on seminars, and they bring in other top veterinarians and show these people that they're not just blowing smoke. That these are valuable tools, and we've seen there just isn't a lot of issues out there today in our neighborhood. Now we're pretty blessed. We still have the guy that hangs his shingle and says, "I'm here if you need me," and that's not what we need in the future. We need the proactive that I'm part of the team. Cow-calf guy listens usually in this order: sale, barn, veterinarian, and the banker if he has to. Those are his three key people. So you are one of them. Utilize it if you can.
Mark, I think it's important that we train them to make certain they're staying up with the industry and its movements. It still grieves me that the last NOM survey I saw, and I could be corrected on this, 35% of our profession were still giving injections in the top butt. And as I tell veterinarians, when you go out to a client and he's read in the magazine, don't do that. He's been told by all the trade associations, don't do that. By the extension service, don't do that. The person selling them drugs, don't do that. And you do that, you've destroyed your credibility, because they know that's wrong and they don't know what your abilities are beyond that to diagnose and so forth. So we have to make sure we stay up and know the industry practices and the latest that's going on.
All right. I guess we'll roll on to the closings. I think it'd be worthwhile to give the organizational committee for this meeting a great round of applause for such a great job.